5, 4, 3, 2, 1. Go ahead, Chairperson.
Madam Clerk, can you call the roll?
Alderman Cone. Alderwoman Ingracia.
Present.
Alderman Gunther.
Here.
Alderwoman Rice.
Present.
Alderwoman Morton.
Present.
Alderwoman Navarro.
Present.
Alderwoman Middlebrook. Alderwoman Clark Hubbard.
Here.
Chairman Muhammad.
Here.
Alderman Cone. Alderwoman Middlebrook. 7 present, you have quorum.
Thank you, Madam Clerk. Today's discussion is early childhood education and its demands regarding returning to work after COVID-19. I will let Alderwoman Ingracia take it from here. She has worked with the group more comprehensively. Alderwoman Ingracia, the floor is yours.
Thank you, Mr. Chairman, members of the committee. I cannot tell who from ECE we have on as speakers, but it's my understanding maybe that you received an email from Lindsay yesterday with an outline, like a run of show. Is that accurate?
It is very accurate. She gave we have a Miss Collins on right now. A Miss Collins, a Lisa, a LaDonna Smith, Samantha Cross. So
I guess if it's okay with you, Mr. Chairman, if you just, I don't have access to that information. If you just want to call them in order of the folks that you have on your list. And I think they were all prepared to speak for just a couple of minutes and then allow us to ask questions.
very good. I will start with Lisa Shear.
Good afternoon. Thank you guys for allowing us to speak. I'm in Ward 2 in the city of St. Louis, Baden, Missouri. And I operate a childcare center here for the last 22 years. We have served the population that we serve. All of our families are on subsidy. And as you know, this has been a hotspot area for COVID-19. We've seen just a lot of that in our area. I wanted to speak to you about our demands a little bit and really just say they're not so much demands as we just want to reach out to you for support. As ECE people, a lot of times it feels like we're invisible. No one really hears us. The schools were asked to close and they were given clear guidelines as to what to do. And we were just kind of left out there to figure it out. I would like to say Wilford Pinkley has been very beneficial and very supportive. I want to thank him personally just for supporting us during this time. But again, it has been really hard. We don't have anything set up. I know it's a pandemic and everybody's kind of, figuring it out. But for ECE, we just have had little to no guidelines or guidance outside of what CDC says. And, if you look at it, what it looks like for us, how do we social distance children? How do we social distance babies? How do we care for them with masks on and socially and emotionally meet those needs that they have? How does it look for us to even put masks on children 2 and up with the guidelines that are set up? How does it look like even bringing them back into our center and us opening back up? Because we're in the city, we had to close. And now when we do open back up, we'll go in at half of our capacity. That's what we're asked to do. And so half of our capacity means half of our income. And then again, the guidelines are for us to have additional staff to not allow parents in. So we'll have staff going out. With the added guidelines, we'll have added staff. And again, half of our capacity, so half of our income. PPE, as you know, it's been, very difficult to get that, but even getting it is a large expense. We're talking thousands of dollars, and our structure already, we struggle. We struggle to, to have a quality center as it is. And now we're looking at half of that income and added expenses. And unfortunately, a lot of people are going to close and we're going to lose. What happens? How do people go back to work if we don't have early care and education? And so we're asking you for your support, for you to partner with us and speak on our behalf. We can come to you. I've reached out to my alderwoman, Lisa Middlebrook. We've been in contact with all of ECE has been working nonstop trying to reach out to everyone we can. And again, trying to use our voice, but a lot of times, again, it just feels we're invisible. Like no one is hearing us. No one understands the importance of how do we get our economy working if we can't operate and we can't open back up and do it in a safe manner. We're expected to be exposed. Yet everyone that we've contacted, they're at home. So we're expected to, open our doors, and we want to do those things. But again, we need support. We need, quite honestly, more money to be able to get the PPE we need, to get the, just to be able to operate and be able to open back up. And so we just need your help with that. That's all we're asking, is that you guys, you hear us and you hear our stories, and we're just, want your help.
Thank you. Thank you, Lisa. I'm going to call the other two people to speak. Then at the end, I will ask if members of the committee have any questions to any of you who testify before us today. Next up is LaDonna Smith of Little Precious Angels Child Development Center in North St. Louis. LaDonna, are you there?
Hi, I'm here. I'm actually located in South City. And I actually have my director on with me. Her name is Samantha Cross.
Go ahead, the floor is yours.
So I actually want to start off, we're located in South City, St. Louis. We're in the 20th Ward. I'm the owner for Little Precious Angels Childcare. And we actually serve, 100% of our families are served, they're low-income families. We receive government subsidies for these families, 100%. And I'm trying to figure out where to start so that I don't want to be over passionate about it, but we're very limited on resources. All of our families, me as a provider, we're very limited on resources such as PPE, just to name a short few of it. And we're asking for your help in general. I've spoken with our woman, Kara Spencer. She's more than a help. I communicate with her a lot, but we're definitely asking for your help. And anyone else that can help us to serve our families. We're asking to be open because of course families need to get back to work, but we're at that end to where we're risking our livelihood. We don't have the proper PPE equipment that we need to support this pandemic. So we're looking to you for support.
Thank you, LaDonna. Does Samantha want to say anything as well?
I absolutely do. I received this email to participate today, yesterday. So I stayed up late last night to write this. So I want to read this to you guys because I don't want to miss anything. So again, my name is Samantha. I work for LaDonna Smith at Little Precious Angels Childcare, located in the 20th Ward. And just like Lisa, 100% of our families we serve are low income and receive government subsidies to provide their most basic needs. As such, their choices for early childhood care education are limited by affordability. In addition, transportation limitations also squeeze their choices into physical boundaries. Low income, inadequate, and often unstable housing situations, and many times lower education of the parents who trust us with their children. When taken together, work against the families from this demographic. Because the state of Missouri does not require kindergarten, many parents do not understand the value and importance of early childhood education. This means that many children in St. Louis City and in low income, predominantly Black wards are not prepared to succeed in elementary school and in subsequent grade levels. When families have to focus the bulk of their time and energy trying to access childcare, food, safe housing, and mental health services, early childhood learning doesn't receive the energy and time necessary to prepare their children for readiness to learn. Children in these wards do not enjoy the same access and experience to the basic foundations that create lifelong learners. In short, without good early childhood education, we are setting these children, our school systems, and our city up for failure. This school to prison pipeline, dependency on government assistance, and pregnancy rates, so much more, all depend on and affect by the lack of quality early childhood education. The majority of our child care providers in the 20 high-risk zip codes in St. Louis City and County are underpaid. Our workers are underpaid. Given the lack of funding, our workers can only be paid from the fees parents are able to pay. Most of them are living paycheck to paycheck, making minimum wage at best, and do not have health insurance. They are actually in similar situations as the families we serve. In addition, many of our workers have chronic health conditions like asthma, immune deficiencies such as sickle cells, which would put them at higher and greater risk of serious complications or death should they become infected. Providing care while also needing care, including basic amenities and securities, are not currently an option given the lack of funding to our facilities. In addition to access to PPE, increased protection and benefits should include free COVID-19 testing and treatment, access to expedited medical care, following New Mexico's lead in covering the cost of health insurance for those who are uninsured and test positive, provide hazard pay to ECE workers with pre-existing conditions that place them at greater risk for serious infection and complications, require open providers to screen children and families per CDC recommendations. There is now pressure to not only provide safety to our children we serve, but also to our workers who are coming from the same backgrounds and environments. Our staff does not have access to quality healthcare, food, income, and education, and so on, which means that we all, the staff, their families, and the families that our ECE centers serve, are at higher risk for great loss due to COVID-19. We are under pressure to open our facilities to serve the needs of essential workers, first responders, healthcare professionals. We are also under pressure to keep our doors open to meet our own financial needs and to feed our families. In order to serve the community, we need action around the requests from the city. Some of our educators have already lost their lives. Bottom line, our workers are as at risk as our families we serve. We do not have adequate means to reach the needs of our community, essential workers or otherwise. It should be noted that the families and communities we are talking about here are primarily Black. According to One St. Louis, out of 48 of the most populous metro regions in the US, St. Louis City ranks as having the 12th highest disparity to household incomes between white and Black persons in 2018. And this was the most recent data I was able to find. The average white non-Hispanic worker earned $71,000 against 2 times as much as an average Black non-Hispanic worker who averages $36,000. If these requests are not put into action, we are risking the ECE centers and they will become infectious hubs for COVID-19. We shouldn't have to choose between our lives and our livelihood. Currently, ECE providers and staff are not unionized. However, we have begun exploring this as an option. Our plans are to reach out to community members, churches, local politician groups, and anyone willing to help us explore this option so that we can protect the workers who are protecting our children. We are reaching out to you for funding support to our St. Louis City community. Thank you for listening.
Thank you so much. Next is Ms. Collins, the owner of Good Shepherd Child Care Center.
Good afternoon, board. Good afternoon, everybody, all the aldermen. Thank you all so much for convening and inviting us into the space to discuss our demand and the needs that we have in early childhood education. As I mentioned, my name is Cortega Collins, and I am the owner of Good Shepherd Preschool and Infant Toddler Center 1 and 2, located in the 1st Ward and the 22nd Ward. We've been operating since 2009. We've been operating in this community since 2009 for over 11 years. And we enjoy providing the services that we do. And we provide a much needed service to an underserviced community. So we do our best to provide high quality early childhood education with the limited amount of resources that are available to us as providers. In both of our locations, we serve 98% of families that receive child care subsidy. In the 22nd Ward, a great percentage of the people, about 80-something% of the people live below 200% of the federal poverty level. And so the services that we provide are integral for the future success of the students in that facility, in that area. So we know from the work of For the Sake of All, Forward Through Ferguson, and the First Step to Equity report, and We Power Tomorrow Builders playbook, that there is a deep divide in our region for young children depending on the zip codes they live in and the color of their skin. There's a huge disparity in the quality of care that's available to Black and brown children. So we need St. Louis City to earmark $5 million of CARES Act funds specifically and exclusively for ECE stabilization funds, prioritizing providers that serve majority of low-income families. We also know that from the fiscal mapping research that ECE was already woefully underfunded before COVID-19. And the people who work in early childhood education, we also are frontline workers. We are the unsung heroes, and we deserve to have a living wage because the work that we do it's extremely important, because without us, the people who are deemed first responders and essential workers cannot do what they do if we don't do what we do. So it's important for us to be able to operate, and it's also important for us to be able to be sustainable after COVID-19. The stay-home order in COVID-19 has changed the very way that we do business, and we will never return to the way that business was. And for us, that's a good thing, because as we mentioned before, we were already marginalized and underfunded, and there was already issues with us even before this hit. So COVID-19 simply shed light on the disparities and the inequalities that exist for children in these communities. So we need for the St. Louis City to earmark the $5 million of the CARES Act fund. And we also would like for you guys to support us in allocating some of these funds so that small early childhood education facilities, small and large, will be able to be sustainable after COVID-19. So we are being asked to open our doors. Some of us are beginning to open. We're starting the reopening process. Some of us have delayed that because we want to make sure that we reopen safely and are able to adhere to the CDC guidelines. In order for us to do that, it will come at a financial cost to us that may be cost prohibitive from some centers being able to open and to remain sustainable after the stay home order has been lifted. So we need support. We need an immediate infusion of funding. It's critical for the survival and safety of ECE programs like ours, which operate on razor-thin margins. When our system is bleeding revenue like this, families will be left to absorb much of the cost, or programs will close, leaving an already underserved community further underserved. Either way, that makes the already dire problem of access to quality, affordable early care and education even worse. So this is a short-term solution to where we're asking continued investment will be needed, such as Board Bill 8. So again, I would like to acknowledge the aldermen that have graciously supported this bill, and it will bring some of the long-term investment we need to support our centers and our youngest, most vulnerable citizens that deserve to be served. Thank you for your time.
Thank you so much. Vice Chairwoman Hubbard, take the
Yes.
lead, please.
Okay. Thank you. Next up, we have Mrs. Ron. Katie Ron. Are you on?
Yes, I'm here. I'm sorry.
Okay, no problem.
Thank you. Thank you to everyone for having us here today and giving us an opportunity to share. My name is Katie Ron. I'm the Executive Director of Southside Early Childhood Center. We're in the 6th Ward. You know, I'm not going to repeat, you know, what my colleagues have so eloquently stated already, but, you know, I think why we're here is truly coming in partnership, offering ourselves as resources. We know that this is a very difficult situation. We know that you all have been incredibly supportive of hearing us and learning about our needs, the needs of our system, and considering some of those longer term strengthening and stability pieces through things like Board Bill 8. Much of what we're reaching out for support around right now, though, is this immediate stabilization piece, which could be achieved through CARES Act funding allocation, you know, through CDBG funds, through any other source that might be applicable to small businesses. You know, we know that you don't have the responsibility of allocating those things directly, but any influence that you have to make sure that early childhood providers are included in the list of folks who are being considered for those funding streams, for the PPE supports that are being put out there. You know, one of the really, you know, trying issues within our system is that it is a decentralized system. So people are operating individually and trying to get their own needs met individually, as opposed through any sort of centralized entity that can help, you know, distribute resources, distribute supplies, access funding, and disperse it out to providers. So it very much is on the individual providers, and the capacity for these types of tasks is typically really low. Providers are focused obviously on caring for the kids and doing what they do, but some of these other pieces of the business administration, sustainability, and right now immediate stabilization is incredibly difficult for folks. So, you know, again, we thank you for hearing us out. We're very grateful to Will Pinckney for what he's done to try to, he was a partner prior to the pandemic and continues to be. But, you know, again, our ask of you is to champion and advocate with us and for us, and in the places where you have influence with other decision makers and policymakers, that we remain part of the conversation, knowing that there are a lot of needs in the city right now. Of course, we know that, we recognize that, but we just want to, you know, have a voice and a seat at the table. So I'll stop there.
Thank you. Thank you for your comments. And next we have Ms. Deanna Finch.
Oh my goodness. Hello. I didn't realize I was going to have an opportunity to speak. I'm the executive director of United for Children. We provide support services to childcare providers, and we have across the state, all over Missouri and Illinois for the last 50 years. Our office is in District 6, and I also live in District 6. I want to, again, applaud the childcare providers here who are amplifying their voices and sharing their experience with you. I just want to give one takeaway, if you can, to think about the ramifications of not having childcare providers in the city for a very long time to come if they have no recourse of building their business back with low enrollment, with low employment rates, families not having a place to take their children when they do have jobs again, and what the ramifications are if children are not in safe, quality learning environments, what the ramifications are to our city and our environments. Thank you.
Thank you, Ms. Finch. I think that's all of the speakers that we have. So now we'll go in order of seniority through the committee for their questions. I think we'll start with Alderwoman Ingracia.
Thank you, Madam Chair. Thanks to all of you for being here and taking time to present to us on this important issue today. I'm curious in terms of the asks in your letter and what you've discussed today, if there's an order of prioritization or if everything is basically of equal priority. To your point, we're not really sure yet exactly how the CARES money is going to be allocated. It's likely that it could go directly through the mayor's office under the emergency proclamation instead of the typical process that we have where it would come through the Board of Aldermen. So I think it would be important for you to try and get a meeting with the mayor and the health director. And if any of us can be helpful in that regard, I think that's a great place to start. I'm happy to hear Will Pinckney has been working with you since he's working with the administration directly. And I know that Prepare STL did a pretty significant allocation of PPE for early childhood education centers last weekend. And then United for Children received a somewhat small, but not insignificant amount of PPE last week as well. So I'm just curious. I understand it's difficult for all of you to organize, but it seems like there's some level of organization already through the work you're doing with Board Bill 8 via Prepare STL and United for Children. Because again, I don't think that we can provide 4 weeks at no cost of all the things that you're asking for, but we would probably be able to help pool resources in some regard to leverage funding and make larger purchase orders or something like that. So if anybody feels able to speak to either of those items, I'd be happy to have a discussion.
Hi, this is Deanna with United for Children. I'll go ahead and speak to this first as our coordination with providers and with Prepare STL and many other agencies. For one childcare center, and I think Katie has a really good calculation on this as well, the cost of masks alone for 1 month is about $5,000 for the size of Katie's childcare center. We have spent $80,000 just on cleaning supplies that are necessary for childcare centers in our region, and we still haven't met everyone's needs. So it's it's an immediate problem, but it's also a long-term challenge when you can only get 1 gallon of bleach on the shelves right now, and for how long. There is coordination. We are weekly talking to childcare providers that we serve. There is coordination between all these agencies. There's communication lines. We have created hubs of distribution hubs that our childcare providers strategically located in areas that are going to be easier to access for neighboring childcare providers. So more collaboration and communication is happening during this time. But to be sustainable and keep going, we're going to run out of funds and, really quickly. And so just, I'll just share that experience with you right now.
Okay, so in terms of what the board, oh, go ahead, I apologize.
No. I was just going to answer your first question around prioritization of demands. And obviously this is a situation that's changing rapidly, like, day to day. So I would say in this moment, I would prioritize the need for financial resources and supports in the shortest term, that programs can then allocate according to their needs. Some have had access to some quick infusion of PPE, others are going to need it and need more of it. I mean, some of the kit, some programs got 15 masks, and obviously that's only going to go so far. I would say from the perspective of how to prioritize, program operating support that can be used flexibly to meet their individual needs, since, size and scale will also, and location will dictate need in a lot of ways, if that makes sense.
It does, thank you. Have you been able to speak with anybody at the Community Development Administration? They house the HUD funds that we receive, or to the mayor or her chief of staff directly?
Not yet, but any support on having those conversations would be welcome, I think, from our group.
Okay, I'd be happy to work with you on that. And then I have one more question and I'll let my colleagues go. If there's a way that I can help with coordination of PPE, it's something that I'm already working on with Prepare STL and the Regional Response Task Force that Dr. Purnell has. And so if you want to talk offline about that, please feel free to sick Lindsay on me or reach out to me directly. I'd be happy to continue those conversations.
Hi, Christine. We are a part of the regional response team. United for Children is, and our early childhood education focus group is tapped in with Prepare STL. I know that they did the canvassing last week and have more coming. And we're also, working with them as well, but happy to keep talking offline too about how else we can work together.
That'd be great. Happy to help.
Thanks.
Thank you, Madam Chair.
Thank you. Next up will be, is Alderwoman Spencer on?
She's no longer on the committee.
Oh, okay. Alderwoman Martin, you're up.
You're
Is
muted.
Alderwoman?
Sorry, you're muted.
Sorry, thought I was unmuted. So I wanted to say this is an issue I care about, and I really appreciate everyone's time. I'm a mom who's had to deal with child care issues, just like everyone else during all of this. And I recognize too that I'm fortunate enough to be able to figure it out pretty easily, but I'm just a little dense on this, sorry, and I have some questions. I'm not totally sure what the breakdown is, I guess, and what you're asking. And I'm also just a little and I've gotten some of the emails, but I'm not really sure what the organization is. And it's okay if it is, an ad hoc organization, but I just want to have some understanding with the structure. And then I'll go ahead and let you answer that. And then I've got some follow-up questions.
I'm happy to take a stab at that. So the letter was written through Ready by 5, which was an initiative that we started a whole collective of organizations to move forward the sales tax initiative in the county, in St. Louis County. And once the pandemic started, we pivoted to how to support immediate needs, not to take away from our longer term strategy, but we really needed to to think about how to support each other in the provider community right now. So that's a whole group of organizations and individuals who have been engaged through from the First Step to Equity report and release and the First Step Collaborative to the Wiebauer DeMauro Bellers Fellows and the solutions teams that developed the playbook, to other community members who are drawn in a variety of different roles. So early childhood providers along with teachers, home-based, center-based, school-based folks. So it's a really pretty broad coalition of people who are talking about this. The demands letter specifically was, I would say, written by Ready by 5, but it was in articulating the needs of about 165 providers who are located in the city and the county. So obviously some of these demands are, and again, demands, I feel like it's a really strong word, but the needs,
ask, whatever, that's fine.
Yeah, the demands are, some relate to the county, some relate to the city, some are statewide. So I'll pause there. I'm not sure if I answered your question.
No, that helps for sure. Another question I had is, are you seeing city residents able to access the additional 66 million in state funds for subsidizing childcare right now?
I'm an 11-year-old who has lots of needs at home too.
I get it.
Lisa,
I guess I would ask with what regard to that. There's been a little bit of an issue with like childcare subsidy, children's cases ending, and part of that was that they would be extended for 90 days, and they're having a whole lot of problems with that. Yes, in theory, that's what happens, but just they have to reapply, they have to go through everything again. It's just a whole lot of paperwork. I've had an increase in people asking for childcare, but of course, that could be related to childcare is not being open right now. So I don't know how to answer that exactly.
I just wondered, with the state releasing those funds, I just want to make sure that St. Louis families are getting their fair share, if that makes sense. I haven't talked to
Alderwoman. Oh, sorry, go ahead.
Oh, I haven't talked to any state legislators about it, if they'd heard anything from their constituents, but I was just curious if that's essentially working or not.
I would say the answer is it is not working well. It has been challenging. There's been a lack of communication and a delay on the payments, although it has been switching to getting reimbursed based on enrollment and not attendance is a great thing. It has been very delayed for folks in quite a convoluted process. I think that the challenge around that side of things, the DSS childcare subsidy payments, to be specific for folks who live and breathe this stuff, the guidance is that the supports that have been identified are through June 30th, and then we don't know what's going to happen at that point, and if it's going to change back to the way it was before, if they're going to continue paying based on enrollment and not attendance, or what it's going to look like. I think a very wonderful thing that happened is that they raised the eligibility limits for families through August. However, at a time in a place like St. Louis where our supply is as low as it's ever been, that's sort of a counterproductive measure when we can't even serve the number of kids we were serving before to raise the number of families who could be eligible for subsidies. I'm not quite sure how that's going to play out, so that's a challenge. So as I mentioned, I think that there are a lot of needs that need to be addressed at the state level. However, I think with the CARES Act funding in particular, what we're looking at is to offset the revenue loss from tuition and program fees, as opposed to some of those issues on the subsidy side. So this would be more about, and from a local perspective, the funds could be utilized to offset those losses incurred during closure or lower capacity, because of the increased number one, people who are still paying their teams throughout this process, but then also for the increased staffing and supplies that are necessary to operate moving forward in the near term.
Okay. All right. Great. I think that's it from now. Thank you. That helps. Thank you,
Okay,
Madam Vice Chair.
Okay, thank you. Next is Alderman Gunther. I'm sorry, I clicked it for a second. So Alderman Gunther, you're up.
Thank you, Ms. Vice Chair, and thanks everyone for being here. I guess my only question was, because going through and just kind of writing down some of what the requests were for not only PPE, but hazard pay, living wage, some of these items that were brought up. And so I was just looking, the Community Development Block Grant has the COVID-19 emergency funding grant that's due right now. Are you guys working individually or collaboratively to apply for those CDBG COVID specific grants that not only go towards childcare, but it also go towards groups that are doing food distribution in neighborhoods and other sort of things related directly to the COVID response? So my only question is, are you guys working on that individually, or are you aware of that funding? Or is this a group thing through like the Ready by 5 or other groups? So that's my only question.
That's a really good question. I would say that there are multiple agencies and providers that's going to be applying for that. There are many aspects of that work and that funding that's applicable and relevant to different types of agencies and businesses. It really is just coming out what it's exactly going to be covering. So there hasn't been a whole lot of time to really dig into all the details. And so we will be looking through all of those, figuring out also if there's a way that we can collaborate in applying, if there's any way to do that, whether it's organizations like ours to help disperse it in a way that's more equitable, or to give technical assistance to providers to apply for the funds. But that's my short answer. And if anyone else has any good answers, welcome to be added to that. But part of this collaborative process, and the regional response team and the early childhood group and the Ready by 5 groups are to really figure out and how to navigate the different types of fundings and the restrictions a lot of those fundings have too.
Okay, and I just, because it was a very, very long application and a lot of the FAQs, just yesterday we got a second list of FAQs for it because there are a lot of questions. But from what I read through, it does seem like, you know, it does address a lot of the needs of early childhood care providers, especially in low to moderate income, neighborhoods. So from my short read of it, it looks like a lot of the things that have been asked for could be applied through that grant. So, so thanks.
Yeah, and I would just echo that again, I think some of that, to your point, Alderman Gunther, is back to kind of the capacity issues that exist within the system. So definitely, I think larger programs are applying. I mean, I finished my application today, but I think just trying to figure out, as we said, I mean, and again, I don't want to be redundant to what we talked about in the previous hearing either, but for everyone, it takes this blending and braiding of as many different streams as possible. So I think that, that's what it's going to take ultimately for even immediate stabilization, then of course the longer term.
Thank you. Thank you for that comment. Mr. Chairman is back. So did you want to take back over?
No, you're doing a fantastic job. Keep going.
Okay, next up is Alderwoman Navarro.
Thank you. Thank you, all of you, for your time today. It definitely, gives me a better understanding of the challenges that you all face, and I very much appreciate and value the work that you all do. And I realize a lot of these challenges, that you've described were here before COVID-19. So, but it is just helpful, I think, for us to hear what people are going through and the challenges, like I said, that they face. Just so that I'm clear, what I'm hearing, it sounds like, how we can be helpful is mostly maybe in advocating that, as if there are funding decisions that we are able to weigh in on, that you're looking for us to be advocates. Is that what I'm understanding? There's not, other than, maybe Alderwoman Gracia can help you, get PPE or something. I just want to make sure that I'm clear on what it is that that I could be doing to help you all. And if it's something beyond that, please let me know.
I will say yes and
That's
yes.
exactly right. Yeah.
Okay. Because we're somewhat limited. We don't have unfortunately our hands on the purse strings right now. But okay, I just wanted to make sure that I understood. So thank you again for the information. It's helpful. I don't have any other questions. Oh.
I would like to add to that advocacy, education, and partnership through this is absolutely important. Now is one of the first times in 50 years since childcare has really become prevalent in our communities and a necessity, that our communities and our governments are really starting to understand the importance of childcare. So you hearing the voices of childcare providers right now is unprecedented and very important. And we thank you for listening. I'm speaking for the rest of the providers, but to your partnership and idea sharing and collaboration as we move forward is really important and appreciated.
Thank you. I don't have any more questions.
Thank you, Alderwoman Navarro. Next is Alderwoman Rice.
Thank you so much. And thank you all for coming in and talking with us today. I was trying to comb back through the email. There's a lot there, and that's really great, but it's also trying to sort out what it is that we can actually have an effect on. And I think that's what my colleagues are also trying to ask here. And I started to think about, one of your asks is to appoint a council to kind of oversee some of this stuff. And I'm wondering is there any sort of overarching organization or board or something like that for early childhood centers or childcare centers that that we could utilize, as a piece of this, or is that something that just doesn't exist in the same way for you all?
It does not. And I think that's, that is what really drives a huge part of the issues within the system. However, to that point, I think that we have an engaged group of folks, experts, childcare providers, and wraparound supports for early childhood who want to come to the table, but we don't, obviously health is not a, most programs don't have any sort of health personnel on site in any capacity. So I think around that whole idea of understanding information as it becomes available, that it's being communicated quickly and out through our networks without a centralized way of doing that. We have been doing that, but we don't have a specific entity that's responsible for that. Those are pieces of our longer term system strategies, around like the MHB expansion, the levy, creating those structures, that infrastructure through those vehicles. They just don't exist yet. They have right now. But I think around the health guidance, just having, whoever that might be, whether it's an infectious disease expert, somebody from public health who can provide guidance that can then be discussed and talked about in the actual context that we have to operate within. Because I think that was part of the major challenges with the CDC recommendations, is that they just were completely, well, first of all, they were just non-existent, but when they finally came, they were so difficult to understand how we would actually implement that in our settings. So having that sort of support in place that we can have real time like information around the community, where we stand in the community, where the community spread, the rates of spread, the hot spots, transmission, you know, all of these things. We've been staying as close to this as we possibly can. And again, Will from the mayor's office has been wonderful in trying to help us. But if we could formalize that so that we can get that information out to providers. A huge piece of this when this first started was, you know, providers just, because the guidance was, you know, so unclear, providers staying open, you know, not getting information directly to them. That was part of the canvas last week, was actually to provide the guides that we put together around how to potentially decide whether you can reopen safely, because we don't have that. And so if it could come from a centralized, if we could create a centralized place and push it out through these networks and all of the things that Deanna described in our individual networks and relationships, you know, that would be ideal, at least in people getting clear and consistent information that's you know, based on research.
Sure. Great. Thank you. That's incredibly helpful. I'm also wondering where that could be housed, and I'm glad that the mayor's office does have Will in the role to deal with children and families, and I think perhaps we can help advocate there to, you know, to create more of a, even if it's a working group or a task force or something like that, that would enable better communication and coordination for you all when, you know, looking at the CDBG applications and all of the ways that funding could come through. And I recognize the challenge between in-home daycares and early childhood centers and all, you know, all across the board, kind of how that works. And I'm wondering, even if it's just gathering information from, like, say, the license collector and figuring out like who actually is operating in the city of St. Louis and how to get all of that information out. Okay, so just trying to brainstorm how else we can be helpful there. So I don't think I have any more questions at the moment, but yeah, I agree that trying to figure out a way to delineate what it is that things that we can help with here, what needs to come from the state. Yeah, and some coordination. I think you guys have given us a lot of food for thought, and hopefully we can be helpful.
I'm sorry, can I add to that?
Absolutely.
And I'm a big advocate of a union for childcare providers, and maybe a union can help us organize and maybe get those things put into perspective for childcare providers. As Katie said, we don't have that board. So yeah, maybe we can kind of go that way to start a union for us.
Sure. And
from you guys.
I think Sarah, Alderwoman Martin, if you had a comment on that as well.
Oh, I just wanted to say, I meant to say this in my questions earlier. If you're interested in that, I can definitely, I already texted some possibilities to represent you. So I know any of us would love to help you with that. So let us know. That is one thing we might be able to help you with.
Absolutely. Yeah, and I think that can be helpful in a both and situation, and that like the workers who need representation and advocacy for, you know, working conditions and all of that, and also how do we coordinate with the government to get you that information, you know, both of those things. So yeah, I think that's great, and obviously let us know how we can be helpful on that unionization front too.
That was the exact thing I was thinking about when Ms. Smith brought up the whole conversation. I was like, a union would be a good start, a union and the council. So Alderman Muhammad, are you on here? Did you have any questions or comments? So this is great. This is a good start. I think this is definitely going to be an ongoing conversation, but the good part about it is that we are clearly all on board to advocate and to support you all however we can, to educate and be a partnership with you all, So
thank you, Alderwoman Clark Hubbard, Madam Vice Chair. I do want to congratulate you on passing out that pivotal piece of legislation that was passed last week, Board Bill number 8, which will invest in early childhood services and programming. Thank you for introducing that legislation. And I also want to acknowledge the former senator of the 4th District, the husband of our colleague, Alderwoman Martin of the 11th Ward. He was selected as the new president of the Missouri AFL-CIO. And during his time in the Missouri legislature, he was an advocate for early childhood education. And he is the reason why a lot of state grants are available to early childhood institutions and centers here in our state, particularly the city of St. Louis. So congratulations to Senator Hummel.
Thank you. And also the senator before that, Senator Kebney, was really, that was one of his main priorities. So we have good representation in St. Louis.
We do. You all have to forgive me. I did not call for the motion to approve the minutes from May 13, 2020. Can I get that motion, please?
So moved.
Can I get a second?
Second.
Thank you. Madam Clerk, can you call the roll?
Alderman Cone. Alderwoman Gracia. Alderman Gunther.
Aye.
Alderwoman Martin.
Aye.
Alderwoman Navarro.
Aye.
Alderwoman Middlebrook. Alderwoman Clark Hubbard.
Aye.
Alderwoman Rice.
Aye.
Chairman Muhammad.
Aye.
6 aye votes.
Thank you, Madam Clerk. With that, our business is concluded for the day. Can I get a motion to adjourn?
So moved.
Is there a
Motion
request?
to adjourn. Previous roll.
Perfect. Thank you all. I appreciate your time.
Thank you.
Thank you.
Yeah.
Thank